Hello, my name is Dr. Sheryl, and I'm a certified naturopathic doctor and a master herbalist and the founder of the Institute of Naturopathic Wellness. And I want to talk to you about a very important subject, which is actually your blood work. So many of my clients and students go to get their primary care, they get their blood work done, but many times they are not getting important tests that really could show them things that they need to know to be proactive. There are 5 tests that I feel that you should know about, that you should be able to ask your doctor, and it's very important that you get these because sometimes they could be higher risk factors than some of the tests that you're getting, like cholesterol. The first one is C-reactive protein. C-reactive protein is actually a protein that's produced in your liver. And when that is elevated, that means you have markers of inflammation in your body, throughout your body, but really important risk factors to the cardiovascular system. So if they are elevated, you're at a much higher risk for heart attack and stroke. Okay? The second one is homocysteine. Homocysteine is actually literally a measurement that the cause of it is being low in certain B vitamins, so B6, B12, and folic acid. And if you have elevated homocysteine levels, that's going to put you at a very high risk for stroke, heart attack, and even Alzheimer's. So that one's super important. The next one, they call it the Widowmaker, and it's actually called lipoprotein A. And that is a test that you really probably only need one time, but it's so important because that lipoprotein A is a type of cholesterol that's a very small particle, and people that have this have a much higher risk for heart attack at an earlier age. Over in Europe, it is mandatory everybody get that test at least one time, but here in the US, they are not testing for it mandatory, so please ask for it. The other one that you should get is a vitamin D3 test. Vitamin D affects everything. It affects your immune, it affects your bone health, it affects your nervous system. Low levels can cause depression. There's so many things that can happen when your vitamin D levels are low, and your cardiovascular risk. So make sure you're getting your test, and they should be somewhere between 50 and 70 nanograms. And if you want them to be medicinal, you want them to be maybe even from 70 to 100. Some functional medicine doctors are recommending that. And then the last one is a full thyroid test, meaning that normally when you go to your doctor, they measure you for TSH. But what I want you to ask for is a full panel, which would mean your T4, your T3, both free and total T4 and T3. And also you want to get your antibodies tested, okay? Because that's going to show you whether you're at risk for Hashimoto's or Graves' disease. So if you're feeling a lot of fatigue, hair loss, different things that maybe your thyroid might need to be more tested, weight gain, make sure you're asking for a full thyroid test. I hope this education has been good for you. And don't worry about remembering all of what I just said, because I actually do have a handout made for you that you can print off, download and print off. So just go ahead and make sure you sign up to get that handout. And I wish you all the best of health. And it is my pleasure to give you education from a naturopathic point of view. God bless.